And step one, of course, we have to figure out what is the need for the health promotion effort and which part of the health belief model applies. Because, you know, we usually have a limited budget, a limited amount of time, so we want to actually target exactly what it is we need to deal with. So you want to ask yourself, you know, kind of make a checklist for yourself. Does the community perceive the threat? Do they think it can happen to them? Do they think it's serious? If the answer is no, that's really where you're going to start your health promotion efforts, which is raising the awareness and education about that and understanding why that message hasn't taken. Or it may be that they see that, but they don't perceive the benefits. So you want to get information, again, from the community of, do they understand why the change you're suggesting would actually improve their health or their health outcomes in some way? You also want to hear about the barriers. You want a list of the barriers, but again, and we're going to talk about how to do this, you need to be working with the community to understand their perspective of what the barriers are. Health promotion work, culturally and linguistically competent health promotion work, can't be done sitting in our offices by ourselves. And we're going to talk more and more about this, and we've got to be out partnering with the folks in the communities we want to reach. We want to find out what kind of cues to action work in a community. You know, is it the brochure? Is it a talk? Is it a video? Is it something in the ethnic media? It's Tawara mentioned, that's a very powerful force, and we know that's an important source of credible information for people from a lot of different cultural backgrounds. And do they believe they could implement the risk reduction action? You know, a lot of times we go out and we give our talks and say, this is what you need to do, and we go off, and we never bother to stop for a minute and say, so what do y'all think? Think you could do this? And hear about what might be the problem. You know, what would we have to do differently? Second step is really to identify and engage key community partners. We've been alluding to this a lot today, so now we really want to talk about it in depth. Again, I want to talk about some principles of culturally and linguistically competent community engagement. As I talked about, our work is really rooted in sets of principles because it really then helps us figure out where we're going to head and how we make decisions. The first one is that cultural competence extends the concept of self-determination to the community. So just because we think that a particular health promotion approach or an even health issue should be of importance to a community, we really need to have buy-in from that community. We have to see their perspective. An example of really this whole issue of self-determination comes from a group that we were doing some training with earlier this year, and they were going out to try and work with Native American Indian population around helping them do a better job of being able to access health information, particularly over the web. Well, when they began to have the conversation with the community, however, they said, yeah, health information is great, but we need better health care for the people in our community. We're not sure we really want to have a conversation about health information. So it really took some time working together and beginning to understand that, in fact, having better health information might help them become better advocates for health care in their community. They would know more about what they were or weren't getting, but it had to be a working together. Had those folks gone ahead and just done their training around health, health education information, it really wouldn't have been particularly useful to the community, and it would have just been another example of a really not very good cross-cultural experience. Another principle. Cultural competence involves working in conjunction with natural, informal support and helping networks within culturally diverse communities. So, for example, it might be a neighborhood civic advocacy associations, the local neighborhood merchants. I mean, sometimes they may be the place where we need to make the connection. Alliance groups, ethnic, social, religious organizations, spiritual leaders, healers. We need to find out who's the person in the community that we need to be working with, and we have to involve them in the process. It's not about us coming out with the truth and doing for the community. It's about working within those structures. Third principle is that community members are full partners in decision making. Now, this is one that's often very hard for us. You know, we see ourselves as the experts about the information, about the health promotion information. We're often pretty used to telling people what to do, not partnering with them and working with them. And yet, if we're going to be culturally and linguistically competent, they have to be sitting at the table making the decisions along with us. What's going to be the focus, even with the content, who, how. They have to be full partners. Communities should also benefit economically from collaboration. So, for example, if we are going to go the route of the brochure, we're going to need a printer. We should be looking to use a printer in the community that we want to impact. Tawara talked earlier about how the policies and practices of the whole organization really impact our ability to be culturally and linguistically competent as we go out to do health promotion training. Well, here's really a case where it's important. If you work in a big bureaucracy, I work in a university, I know many people work in government systems, there's all these rules about procurement, you know, whether it's the cheapest bid or only certain vendors. So we really have to be able to advocate within our own organizations if we want to be culturally and linguistically competent in our health promotion training and being able to have this economic reciprocity with the communities we want to work with. Community engagement should result in the reciprocal transfer of knowledge and skills between all collaborators and partners. We may know something about the health issues, the community people know about their community, about their culture, about their beliefs. We should walk away feeling that we learned as much as we offered, if not more. Employing those principles, I know, is not easy. And we often hear from folks that they really have wanted to reach out and work with the community, and yet they can't seem to get people in the community to the table. And there's a lot of reasons for that. You know, again, I think Tawara talked about we have to really know about how the organization we're part of is perceived in the community. And it also may be that we don't know the right people to approach, we don't know the right ways to approach. And there has to be a level of trust for people to want to work with you on something. You know, we think what we're bringing is great, but they don't really know that. I'd like to give the example that if you were walking down the street one day and a complete stranger walked up to you and said, "Want to come to my house for dinner?" you would be backing away pretty quickly. You'd think like, who is this person? What are their intentions? Do they want to harm me? I don't know them. You know, I can't just go walking off with them. Same is true of many of the communities we're working with. They don't know us. They don't know our intentions. They don't know if we're there to do something helpful to them or not. I know coming from universities into communities, they've often had experiences where people have come and done research, used them as subjects, and they've really gained nothing from it. So that's a problem. So imagine now for a minute, though, that you're standing on the street with this strange person who's come up and accosted you and said, "Come to my house for dinner," and suddenly your best friend comes along and comes and says, "Wow, what a coincidence. I can't believe you're here talking to my best friend Dan. I've always thought the two of you should really meet. You have so much in common and you really get along, and I'd love to have the two of you just meet and talk, and why don't we all go to lunch?" Well, then you might be more likely to do it because there's somebody who you know and trust who's vouching for the trustworthiness of this other person. And you know they'll be there, you know, in case anything happens that you're not comfortable with. Well, we have a concept that we talk about which is called cultural brokering, which is really a little bit like that. It's the idea of having a person or persons who act as a bridge or a link or a mediator between groups or persons of different cultural backgrounds for the purpose of reducing conflict or producing change, reducing conflict or producing change. So we're calling this cultural brokering. And it's a really helpful approach to be able to connect with and engage with a community you don't have a relationship with, because they're that person who make that bridge.